We present a series of videos, instructional videos on oppositional defiant disorder. Let's define ODD. Persistent pattern of tantrums, arguing, and angry or disruptive behaviors toward parent or other authority figures according to Mayo Clinic. Is a psychiatric disorder affecting behavior according to this website. And according to WebMD, it's a condition in which a child displays an ongoing pattern of uncooperative, defiant, hostile, and annoying behavior toward people in authority. Now, what are some of the symptoms or descriptions according to different sources and the DSM-4, which is the diagnostic tool that psychologists use? Well, negativity, defiance, disobedience, hostility toward authority, temper tantrums, argumentativeness with adults, refusal to comply with rules, deliberate annoyance of others, blaming others for mistakes and misbehaviors, uncontrolled anger, responding more often with verbal aggression than physical force, anger and resentment, spiteful or vindictive behavior, aggressiveness towards peers, difficulty maintaining friendships, academic problems, lacks accountability, touchy and easily annoyed, swearing or using obscene language or gestures, saying mean and hateful things when upset, uncompromising. Now, children will go through some of this, and that doesn't mean that if there is a spurt of this, that they should be given the label ODD. According to the information, they have to have at least 4 to 6 of these characteristics over a specific period of time. Is there any test and diagnosis? There is no clear underpinning ODD according to Mayo Clinic. In other words, we can't find the cause. According to this website, although there's no clearly understood cause, and you have a ... there, and they go on then to speculate about what the cause might be. And because they speak with a sense of authority, people walk away saying, well, that's the cause. They clearly say there is no clearly understood cause. According to WebMD, the exact cause of ODD is not known. However, the general repetitive conclusions are the cause is inherited and or environmental. In other words, the home environment that is taking place, maybe the school environment, that which the child is living in, can be a contributing factor. It's not the cause, though. The criteria for diagnosis, well, it begins with reporting of behavioral problems by parents and by teachers. A general medical evaluation is given. If no organic cause, in other words, there's nothing wrong physically with the child's body, if no organic cause is found, they are referred to a psychiatrist or psychologist that specializes in diagnosing ODD. The child must have displayed this behavior for 6 months, there's your time frame, and have at least 4 of the symptoms described in the previous list that I showed with you that comes in part from the DSM-4. The onset, when can this begin? Most of the literature says as early as a toddler, usually by 8 years old. It affects more males than females, and if not addressed, you will have a troubled adult. What are the treatment options? Well, individual and family therapy. We have parent-child interaction therapy. We have cognitive problem-solving training. We have social skills training. We have parenting training. all the resources consulted clearly state that there is a need for those in authority to be consistent in discipline and correction, reaffirming the child when behavior is acceptable. All resources consulted also clearly state that ODD may be the result of ADD and ADHD. The use of medication for ADD and ADHD would help correct ODD. But in either case, ODD, ADD, ADHD, you got to be careful here, you can get your tongue wrapped around all these letters, there is still no clear demonstrative cause, organic cause for this. So we're still dealing with subjective interpretation, believing that the medication is bringing some type of resolution instead of just control. For more information, check us out at the World Wide Web, www.mountcarmelmin.org. Also check out the other video that will be posted about biblical solutions now for ODD.